Tom Gonzales, Deputy Director, Public Health, and with me is Shannon Rowe, our Program Manager at Communicable Disease Program at Public Health. We have been asked to provide a brief update on the Zika virus to the board. But first, it's important to know that Public Health provides Zika updates to many stakeholders within El Paso County, primarily our healthcare coalition members. Those members include hospitals and long-term care facilities, our emergency managers at Colorado Springs and El Paso County, and the University of Colorado Springs, and Colorado Springs Utilities Office of Emergency Management. These updates provide timely information on the disease, the risk, prevention, and situational awareness in Colorado. When we receive new information regarding Zika transmission and prevention, we relay that information to the group immediately. Now I will turn it over to Shannon Rowe, who will give an overview of the Zika virus.
Good morning, everyone.
Good morning.
So Zika virus, it's a disease that's spread through the bite of a mosquito, and the mosquito is called Aedes aegypti. And the illness is usually mild. It includes fever, rash, joint pain, conjunctivitis, and only about 20% of infected people actually develop symptoms. And there's currently no vaccine or medication to prevent Zika virus. So this is a picture of the mosquito that causes Zika virus. And Zika virus was first discovered in Africa in the 1950s. And it's somehow made its way over to the Central and South America. And it also carries dengue, yellow fever, and chikungunya virus. And it's really important to know that the Aedes aegypti mosquito cannot and does not live in Colorado. And just last week, CDC actually put out some new guidance that said that there is minimal likelihood that transmission of Zika virus could happen in geographic locations above 2,000 meters, which is about 6,600 feet.
And that's the transmission by the mosquito, not the sexually transmitted?
Correct,
Obviously.
yes, by the mosquito,
Yep.
yes. So you mentioned transmission from mosquitoes. That is our primary concern. So we primarily are concerned about people traveling to a place where Aedes aegypti mosquitoes live and have Zika virus. That is the most common way for someone to get Zika virus. And again, it's important to note that Zika virus, that the Aedes species is not found in Colorado. We've also learned that Zika virus can be spread through an infected mother to her fetus during pregnancy and also to her newborn during delivery. And also it can be spread through sexual contact by a man to his partner. And it's important to note that that man has to have traveled to a place where there is Zika virus and become infected with Zika virus. So where is Zika virus? There's 31 countries in the Americas, including Puerto Rico, where there is local transmission. Also 5 countries in Oceania and Cape Verde in Africa. So if you see those tiny little circles off to the left and the right, that's the Oceania countries that are affected, and then the little circle off the coast of Africa is also affected. But you can see primarily it's Central and South America. And if you notice, Argentina is not highlighted, and that's because it is up so high.
It also looks, from what I'm seeing here, down in the Baja. I mean,
Correct.
go down
Mexico
to
is a country that has Zika virus transmission.
Cabo, other places that people travel on a consistent basis from Colorado and the United States, I think.
Right, right. And so currently in the United States, there are 197 travel-associated cases of Zika virus that we've detected, 2 of them in Colorado, not here in El Paso County. So what is Public Health doing in response to Zika? We've been providing updates, as Tom said, to healthcare providers through our Health Alert Network messages and even individual consultation. We have healthcare providers call us when they're concerned that a patient they have may have contracted Zika virus, and we help walk them through what to look for and what to test for. And we're also sharing prevention messages, both internally and to the public. We have a great, robust website that links directly to the CDC regarding Zika virus. We have fact sheets. We have just a general fact sheet, a pregnant woman fact sheet, a traveler fact sheet, and also we've been doing a lot of media interviews. And we also do outreach directly to clients at El Paso County Public Health with emphasis on pregnant women and travelers. So our programs who come in contact with pregnant women and people who are traveling, we let them know what their risks are when traveling to these countries. We're also working closely with the Colorado Department of Public Health and Environment to learn the most up-to-date information about Zika, and with CDC. And we're doing that to detect and report cases as they come up. Any questions?
Thank you for the information. Can you just talk a little bit about, I think the slides spoke to it a little bit, but basically, are we at much risk here in the Pikes Peak region? Because it seems fairly remote for us. I know that there have been several counties in Florida and in other parts of the country that have been essentially declared disaster areas for the virus. But can you just speak to whether folks here need to be concerned, and if they are, what they should know?
Our primary concern would be if someone were to travel to an area that's affected with Zika. Currently, the mosquito does not live in Colorado and could not survive in Colorado. Our harsh winters and dry climate would break that cycle. So no, there isn't any risk for Zika virus transmission from the mosquito here in El Paso County.
Kind of switching related subjects.
Sure.
West Nile virus, we've known, has been a problem here. Any other things that we're looking at on the horizon for this upcoming year that we just need to be aware of in terms of what might, what new things might be coming forward from a public health standpoint?
I'm just waiting for the summer to see what Zika
Yeah.
will bring. The
We have had a
travelers
lot of
mostly.
rain this year, so
Yeah.
I guess maybe Tom has some more information.
Good question. The difference there with West Nile virus is the mosquito, the Culex tarsalis, is in Colorado, and although it doesn't like the high elevations either, but West Nile virus is now endemic in our area, means it's here, which we are always practicing the caution, certainly what we call the 5 Ds. That's wearing DEET, making sure you're wearing long sleeves and long pants at dusk and dawn, and taking your preventive care for mosquitoes, especially the Culex tarsalis. Those are the littler ones that can carry West Nile virus.
From what you said, the mosquitoes that carry Zika are not here at all.
No, the Aedes aegypti, it has to have a very warm climate for the larvae to survive, which and that's that full cycle for 12 months, which our winters break that,
Right.
thank goodness. Where other mosquitoes that we have here, they can survive through the winter.
Things to be aware of in terms of standing water, things that we need as we start to look at outdoor maintenance, standing water that may have been there for a while. It might have been snow that melted, or ponds or fountains that we're cleaning out. What's your suggestion for the average person out there, just to make sure that we don't breed mosquitoes unnecessarily?
The Culex tarsalis likes dry, mucky water. So you walk around your yard, you may find an old flowering pot that's been sitting on the side after it rains. It's just sitting there. That's dry, that mucky water. You can actually get quite a few larvae to mosquitoes just from a small area. So even walking around your yard, if you find us noticing these standing water, that's where you dump that water. Make sure you get rid of that standing water. Certainly what we normally see with Culex is July, June-ish area. Certainly last year was odd with all the rain in May, and it was colder and much more water flowing. We saw the Culex kind of blossom out, if you may say, in July. So certainly the summer months, dump the standing water. If you got the kid pool going out, make sure you dump the water after using it, certainly.
Shannon, back to Zika. The Olympic Games will be in Brazil this summer.
Yes, they will.
So there will be hundreds, if not thousands, of people from El Paso County traveling down there. What do they need to do to keep from being infected?
The Olympic Training Center and the Olympic Committee has been working diligently to provide education to those who may be going to Brazil. And basically, it's mosquito protection. So if you're traveling down there, they want you to wear long sleeves, use permethrin-treated clothing, and if you are a woman of childbearing age, consider not trying to become pregnant while you're traveling to Brazil.
Great. So you go to Brazil in the summertime, you're supposed to wear your flannel.
Well, no, they make really lightweight long-sleeved clothing.
One of the things that I'd asked Dr. Jim Terbush when he was still there, and Dr. Den Martindale as well, to have you and Tom address, Shannon, is the incubation period. So let's say that people do go down to Brazil, or not to Brazil, but down to the Olympics this summer, and contract it. How long is the incubation period? What are some of the symptoms that people can expect? How do you know when those symptoms have subsided and you're no longer contagious, if you will? I mean, I know it's only through transmission. Is it only through transmission, or is it through any bodily fluids, or how is that?
So I'm going to address your last question first, because that's something they're still researching. It's still unknown. So far, we know that it can be contracted through semen and, blood, but I don't know if there are other bodily fluids that you can get Zika virus from. Aches, pains, fever. There is a rash associated with it, conjunctivitis. And to answer your question about the time it takes for you to become ill, it's a week to a few weeks.
We could have people going down there for the Olympic Games, coming back and not knowing for a week to a few weeks if they're infected or not. So the precaution that you would probably put out to the news media and to citizens would be that, if they do go there, just come back and take all risks, if you will, as that might be associated with that for a few weeks to ensure that you don't have anything.
Yes, and it's important if you are traveling to a Zika-affected area and you come back and you develop symptoms to communicate that to your healthcare provider, let them know where you have been, because there are other diseases that you could have contracted down there, such as dengue, yellow fever, chikungunya, and they have similar symptoms.
So to make sure that they're not, behaviors going to not perpetuate or spread.
If you're a man who's traveled to a Zika-affected country, you need to communicate with your partner about where you have been, especially if you start developing symptoms and you need to use contraception.
What are some of the outcomes? I mean, I know I've seen some of the things on the internet that are pretty atrocious for women who contract it, who are pregnant, and some of the birth defects that are seen from that.
Unfortunately, yes, Zika virus is the first communicable disease in about 50 years that we have seen to cause a serious birth defect. The one before that being rubella, which caused blindness. And Zika virus can cause sudden abortion, microcephaly, which is a very small head of the child, and that's a lifelong detriment for the child.
Not quite done, not ready to change subjects yet. I just still had a question. And thanks also to Commissioners Heisey and Clark for serving on the Board of Health. I appreciate that and the work that you do with those folks over there. So I just want to be clear. A lot of people are asking questions about Zika, obviously. Of course they are. And a lot of people travel into these areas. If a person comes back and has Zika, can a mosquito native to Colorado bite that person and infect another? Essentially grabbing onto a whole different group of mosquitoes to spread it.
I had to ask the medical entomologist, which is a study of bug person, at the Colorado State Department of Health, and she said that no, currently the mosquitoes that we have here in Colorado could not carry Zika. I'm imagining it's something to do with the mechanics of their body, their stomachs, their mouths, things that I don't really understand about bugs, but...
It's just fascinating.
Yes,
Okay.
it is.
Well, that's good news, and
Yes.
hopefully that will remain true. If a person is infected, and granted, we've heard a lot about, it's kind of benign as long as a woman isn't pregnant. A lot of people some people don't show symptoms, or they're very, very mild. Does the virus stay in your body forever after that? How long does the virus stay in the body even without symptoms?
The CDC does say that once you have contracted Zika virus, you are immune.
I just wanted to be clear on this as well. You did talk about the various bodily fluids that we know of right now, but then you also talked about same-sex transmission. Is that the only? I mean, it seems like there are two different pieces there. So I understood it would be any sexual transmission, but okay.
that currently there's no evidence that a woman can spread Zika through sexual transmission.
Okay.
Is that your question?
That was my question.
Okay, good.
I also did, and we'll see if there are any other questions on Zika, but I also wanted to ask about the flu, how we're doing. I know that we had an outbreak here at the county with a lot of our staff that were down, a number of staff who had the quadrivalent vaccination and still got hit with it.
Yeah, we're definitely experiencing our peak. Well, I can't say it's our peak, but it's climbing. We do hospitalized influenza surveillance at the health department, and because that is what is reportable. And so far, we have 79 cases of hospitalized influenza, and if I could show you our graph, that's last week was our highest number of cases that had been hospitalized. However, if you compare it to the last flu season, it's much milder. Last flu season, we had about 340 cases of hospitalized influenza, and that was actually more than when we had the pandemic.
Wow.
So even though we are starting to see increased influenza activity, it is still much milder, but it's also not too late to get your flu shot.
The flu influenza A and B, both strands, are rather late this year.
Okay.
So we're seeing this late, hopefully the spring break and everybody breaks off that we can maybe stop this, but it is increasing. We're hearing from our medical providers an increase in positive samples for influenza for A and B. So normally it's a little bit earlier in the season, just a little bit later, so that's kind of throwing us off.
Some people are starting to say that this year's vaccination isn't protecting anyone. And I'm sure you guys cringe when you hear those kinds of things. So, and of course, it's limited protection. You never know how the flu is going, what strains are going to be out there. But what are you seeing in terms of the effectiveness of this year's vaccination?
It's always tough because they try to take the last 2 or 3 years, whatever, if H1N1 or it's H2N3, that's the specific virus and what it looks like and how it acts. But certainly if you get introduced to a new virus that hasn't been in the last 3 or 4 years, yeah, you're that vaccine, unfortunately. But again, we still see it, the efficacy, the effect rate of that vaccine is pretty high. Without vaccine, it could be a lot higher. So we certainly promote the vaccine, especially with our children and our elderly. That is a very important population that should get that vaccine.
Great. Thank you. Any other questions on any of these? All right.
Thanks.
Thanks
Thank
very
you.
much. Very, very good to hear the report. Appreciate it.
Thank you.